It's a pleasure to participate in the video for application for accreditation for the Comprehensive Inpatient Vascular Surgery Center. My name is Clem Darling, and I'm the Chief of the Division of Vascular Surgery, Professor of Surgery, and the Director of the Institute for Vascular Health and Disease at Albany Medical Center. Albany Medical Vascular Surgery has a long interest in the specialty of vascular surgery, starting with Dr. Robert Leather, Alistair Carmody, and Durraj Shah in the 1980s. Albany Medical Center is the largest and busiest academic hospital in the upstate New York region, and it covers a large rural population, essentially from the Canadian border to Westchester, New York. Our group has had a long history of working with our interventional radiologists and cardiologists, as well as our cardiac surgeons. In 1998, we formed the Institute for Vascular Health and Disease, combining vascular interventional radiology with the vascular surgery division. In 2004, we were outsourced as a vascular surgery system and created a large hub and spoke system that covered over 150 square miles. This allowed us to provide vascular care for a large rural population and triage the most difficult and potentially morbid cases, such as ruptured abdominal aortic aneurysms, to the tertiary care center, which had 24-hour anesthesia, helicopter delivery system, as well as hybrid operating rooms, a tremendous well-thought-out infrastructure that consisted of 2 vascular floors with vascular-trained nurses run by Jen Logan, a vascular ICU, VICU, run by Minnie Dame, and 3 vascular ORs run by Michelle Budge. We also had a room in the vascular interventional suite for daily use, given to us by Gary Ziskin, professor of radiology. Again, our history with working with our radiologists and cardiologists had allowed us to build a vast multidisciplinary system to support these complex patients. Also, Albany Medical Center has provided us with a place to meet daily to discuss recent transfers as a group, and not to only educate, but also provide an open forum to come as a group, form a consensus, and find the best individualized care plan for each of our patients. Over 40 years, we have had a vascular database which has allowed us to analyze our outcomes and evaluate new techniques and products. Today, we are adding the Vascular Quality Initiative, the VQI, to our system to evaluate best practices in our care. Concurrent with this, we developed a comprehensive training system for not only residents and fellows, but also for vascular attendings wishing to learn about new techniques, as well as creating systems for vascular emergencies such as ruptured abdominal aortic aneurysm repair. For transfers, we have a single number to call that allows outside hospitals to call the transfer center, packs the images, and immediately start the transfer without delay. This has allowed us to have one of the largest volumes of aortic emergencies in the region, if not the country. As mentioned before, Albany Medical Center has allowed us to have 2 floors of vascular patients staffed by vascular-trained nurses, most of which belong to the Society for Vascular Nursing. We have been lucky enough to have 4 of our nurses become president of that society, the last being Patty Flanagan, who runs our nurse education program. She's integral in training our nurses, our residents, fellows, medical students, and even our staff. Also, we have a 25,000 square foot facility in an office building adjacent to the medical center, which houses our patient evaluation office, our vascular lab, our outpatient angio suite, outpatient vein suite, our data management center, as well as our academic offices. In this video, we will walk through and describe the patient's journey through our vascular system. Marie Rossi will describe the process of preparing the patient for procedures and communication with our referrals. Carrie Riley, our PA, will discuss our one-stop shopping approach to patient evaluation. And Joanna will describe how the vascular lab is coordinated into our system, inpatient and outpatient.
My name is Carrie Riley. I'm a physician assistant for Albany Med Vascular. We have 4 APPs in our system and see about 40 to 60 patients a day in our clinics. We have 13 exam rooms and 4 vascular lab rooms. Much of the patient's demographics, clinical data, and medications have been preloaded into the EMR system, allowing the provider to review it prior to seeing the patient in the office. Typically, the LPN will bring the patients in, take their vital signs, review pertinent medical history, medications, and social history, including smoking history. Smoking cessation is always discussed and documented. The provider reviews the clinical data and performs a physical examination. Most vascular lab exams have already been scheduled when the intake evaluation was performed over the phone. This minimizes wait times, but additional labs are ordered as appropriate. The vascular provider reviews the data and discusses the plan with the patient and family. All potential options are reviewed, including medical, percutaneous, and surgical options. A care plan is then outlined, and the patient is scheduled for a follow-up appointment or intervention as necessary. Patients are sometimes scheduled as an outpatient in the vascular angio suite or as a hospital-based outpatient if they do not meet criteria secondary to comorbidities, such as weight, severe heart or lung disease, or complexity of the procedure. Follow-up visits are then scheduled as appropriately. After an angiogram, if an open surgical operation is indicated, the patient and provider review the risks, benefits, and options of the surgery. The consent is obtained and all questions are answered.
We have 3 RNs in this role divided into teams consisting of 3 or 4 providers and a secretary. We are responsible for educating patients and their families on all procedures and follow-up. We may do this in person at Albany Med sites or over the phone for the outside offices we cover. We have education booklets and appointment schedules for all procedures that are given or mailed to the patient. We are the primary contact and provide a bridge between the patient and the patient's families and the physicians, answering numerous calls throughout the day, providing continuity of care. Scheduling of procedures takes a lot of coordinating. For example, provider availability, the place, patient family availability as well, dialysis, clearances, just to name a few. Angiogram procedures are scheduled by us in both our outpatient procedure area and Albany Med interventional radiology. They have to meet certain criteria to be done in our outpatient setting. Vein procedures are scheduled in our outpatient suite by an LPN. Occasionally, they need to be done in the hospital setting. Depending on the procedure needed and the patient's comorbidities, we will obtain labs and clearances from a variety of providers. We are responsible to make sure all appropriate information is available on the day of the procedure. After the procedure, we help answer questions concerning the patient's post-procedure care and make sure they have post-procedure follow-up.
The Carmody Vascular Lab is accredited by the IAC, which is the Intersocietal Accreditation Commission. We are accredited in 4 areas of vascular testing: arterial, venous, visceral, and cerebrovascular. Our lab consists of 18 registered vascular technologists who perform an average of 30,000 exams per year. We have multiple off-site locations that we currently see outpatients in. In our Albany Myrtle Ave office, the vascular lab sees patients in our clinic, in our procedure suite during vein procedures, and after angiography procedures. Our inpatient lab in Albany Medical Center consists of 2 dedicated vascular ultrasound rooms and 2 portable ultrasound units, along with a portable PVR machine we use to do bedside exams. Our inpatient lab is staffed 7 days a week. The vascular technologists are in constant communication with other staff and providers to create the best patient care possible.
Welcome to Albany Vascular Group's outpatient office-based laboratory. This is an office-based laboratory where we can perform procedures as an outpatient on our patients to avoid the hospital setting, and that provides a lot of ease of use and patient satisfaction and comfort. And this is the patient experience. Come in right off the parking lot, straight in. It's very easy, especially when our patients are elderly and sometimes can't walk very well. They come right in off the parking garage, right through here. Come to the front desk where they're greeted, and the changing rooms are right behind us over here where they're able to change. And this office-based laboratory is attached to our offices and our clinics, so it's very convenient for us as physicians and surgeons, as well as our patients. And we're able to do a wide variety of procedures here, everything from diagnostic to even therapeutic interventions. And that runs the gamut from dialysis access procedures and working on fistulas to stenting arteries, stenting veins. We can pretty much do almost everything we do at the hospital in the angio suites there. All the monitoring devices, suction, telemetry, everything's available to provide a safe and relatively nice experience despite having a procedure performed. Our office-based laboratory offers great convenience and great efficiency, and our patients love it. What we do here is we make treating vascular disease much easier to tolerate because sometimes this is the worst moments in patients' lives.
Vascular patients going for surgery will be going through our pre-admission testing department. They will be called to be scheduled for an in-person visit if needed, or a call will be conducted to do a telephone interview. This is dependent on the patient's current health status. For a PAT in-person visit, the patient will see a practitioner who works for the anesthesia department at Albany Medical Center. They will be making sure that the patient is safe for the anesthesia that they will be getting during their surgery. If any clearances are needed, they will ask the patient to schedule an appointment and be cleared by that physician. An example would be a cardiologist. They would need to get clearance prior to that surgical procedure so that they can have their surgery and be safe. The telephone interview would be conducted by either the practitioner or our RN also working for the anesthesia department. They will go over the patient's health history to make sure that they are safe for that upcoming surgical procedure. Once PAT has been completed their part of the process, the patient will receive a call the day before their surgical procedure from the pre-op care unit with the time of their arrival to the hospital for that surgery. After arrival at the hospital the day of the surgery, the pre-op care unit will get the patient ready for their procedure. The patient is then seen by the anesthesiologist and the surgeon in that pre-op care area prior to going to the OR.
I'm the clinical service line lead for cardiac, vascular, and thoracic surgery here in the operating room. My clinical service area within this unit is comprised of 7 operating rooms, 2 of which are dedicated to vascular surgery at all times, but any of the rooms can be used as a vascular room if needed. Vascular surgery is one of our busiest services at this hospital. They run 2 fully scheduled rooms every single day. The main room is for our large complex open cases, and they run a second room for the shorter cases. We also have a hybrid room ready at all times for endovascular procedures and emergencies. Vascular surgery also has a dedicated set of staff who are highly knowledgeable in their specialty. Due to our high volume of patients and their level of acuity, there are many people involved in the coordination of their care. Every day, leadership across several disciplines, anesthesia, surgical team, and the nursing team meet to go over the schedule for the next day. This ensures we have proper staffing, equipment, and services coordinated for every patient.
We perform most of the anesthesia for the vascular service and work closely with the surgeons. For complex aortic cases, a TEE is always available. We use a multidisciplinary care team approach to take care of the patient. We also follow up on our patients in the vascular ICU.
Our group has extensive experience in complex open as well as endovascular treatment of aortic disease, and we have a great relationship with the vascular surgeons. Our faculty are experts in high acuity anesthesia care and management of challenging vascular patients presenting with significant comorbidities.
My name is Gary Siskin. I'm the chairman of radiology here at Albany Medical Center, and I also run our division of interventional radiology. For those of you who know what interventional radiology is, you must know that we work very closely and collaboratively with our vascular surgery colleagues. We have a great working arrangement here at Albany Med. We turn to each other to handle the most difficult cases in vascular and endovascular care. And I think we're quite fortunate here in Albany to have a very skilled and expert group of vascular surgeons.
Our vascular ICU has been around for a number of years. Our nurses work in the post-cardiac surgery and vascular intensive care unit. They are trained to take care of the critically ill vascular and cardiac surgery patients. The number of beds can expand depending upon the need, and we average around 4 vascular ICU patients daily. We work closely with the vascular surgeons, the vascular fellows, and our surgical critical care attending group for coverage of our critically ill patients.
We are fortunate to have 2 vascular surgery units here at AMC that can house 24 and 22 patients respectively. These floors are currently staffed by 110 talented and hardworking individuals, including over 40 trained vascular nurses. We have 2 excellent advanced practice providers to assist us in the postoperative management of our patients and assist with their timely flow through our facility. As nurse manager, I run multidisciplinary discharge rounds on each unit daily. These rounds are attended by our advanced practitioners, staff nurses, social workers, case managers, physical and occupational therapists, dietitians, as well as consulting hospital physicians to ensure that all members of the healthcare team are on the same page. Our QIT meets monthly to discuss quality concerns across the spectrum of vascular care at AMC. We endeavor to place our vascular patients on our vascular floors so that they can benefit from our work. The vascular surgery census often exceeds 50 inpatients and consults, so we do have some overflow, but we make every effort to get these patients transferred to our floor as soon as possible.
The role of the vascular nurse clinician ensures quality patient care through evidence-based practice, quality improvement initiatives, and standardized care. Vascular nurses are trained to provide quality care via orientation, professional development, and clinical competencies provided by the nurse clinician. The nurse clinician educates the staff on the use of the evidence-based practice model and facilitates the process during presentations of PICO practice change requests at Unit Practice Council. The nurse clinician monitors nurse quality indicator reports and provides education as needed, followed by use of the Lean Daily Management Huddle Board for reinforcing and monitoring practice. The nurse clinician reviews practice guidelines and collaborates with the vascular quality improvement team in the development and maintenance of standardized vascular pathways. The nurse clinician mentors nurses in professional development by promoting vascular nurse certification, encouraging use of exemplars to facilitate professional growth, and ongoing education. The nurse clinician facilitates clinical competencies to ensure evidence-based quality care via skills fair, one-on-one redemonstration, and observing the nurses in the clinical setting. These are a few of my roles as the vascular nurse clinician here at Albany Med.
As many of you know, vascular patients are followed by their vascular surgeons throughout their entire lifespan. And to facilitate this, we have 10 satellite offices with portable vascular labs so that we can follow these patients up in their own region. This has become an integral part of their medical care and our long-term follow-up. We have 2 full-time data collectors for our registry and for VQI. Our goal has been to offer cutting-edge, cost-effective care to a large rural region while maintaining local follow-up with excellent results. Obviously, this could not be done without the hard work of our staff, well-trained vascular nurses and vascular technologists, as well as a dedicated group of vascular surgeons who have dedicated themselves to a communal approach to vascular surgery. Again, this is an honor to participate in this excellent and much needed process. Thank you very much.